surgery. You know, there is a little bit interesting thing I have found again about the Sjogren syndrome, little bit evaluation, yeah? I will not read everything, just take a look, yeah, to be fully aware what does it mean Sjogren syndrome, yeah? So, and the next slide will be about this, again, aqueous Tear-Decient Dry Eye. This is secondary Sjogren. As I told you, it is one of these, or group, it is a group of autoimmune connective diseases. Yeah, most often we face people with rheumatoid arthritis and systemic lupus erythematosus. Yeah, you know what? I would say a little bit, yeah, a little bit. Just refresh your memory. Yeah, about rheumatoid arthritis. You know, it's mostly pain, joint pain. Yeah, it could be just one joint. Yeah, sometimes actually such kind of people come to us directly, not through optician, but directly from, I mean, directly booking a time, yeah, for visit, because a lot of them have quite a big disturbance with dry eyes, yeah. I would say they have still a little bit less dry eyes than Sjogren, primary Sjogren syndrome, yeah, but often they have also quite dry eyes, yeah. But some of them, I mean, people who have already diagnosis, yes, they have some pain, joint pain. It's just, remember, it could be just a little bit here or a little bit here, just one joint or two joints, or often fingers, yeah. All the person, bigger chance to have this rheumatoid arthritis, but it could be also around 30 years old. It could be even 25 years old person who have rheumatoid arthritis. And keep in mind that there are quite big group of people, young people and babies who have also rheumatoid arthritis. Sorry, I'm actually working quite a lot of this juvenile rheumatoid arthritis, because all children who have a diagnosis of rheumatoid arthritis below 15, yeah, 15 years old, they have the diagnosis of juvenile rheumatoid arthritis, and they're coming also regularly to us for eye check. Not dry eye, but mostly iritis, yeah. But I tell you, just keep in mind this. Here, definitely, if you suspect or person tell you that he has rheumatoid arthritis, yeah, Schirmer is mandatory, Schirmer test, and Rose Bengal actually also mandatory. Because you need whole picture, not just breakup time. Whole picture of conjunctival staining and proper corneal staining, yeah? And Schirmer is also essential. I would say even in such conditions, most probably Schirmer will be below normal. But again, look how much, because it's people are different. Maybe with rheumatoid arthritis, he has still acceptable Schirmer and a not so bad Rose Bengal, yeah? Just a little bit. In such patients, you can use contact lenses for such patients, yeah? And number two, lupus erythematosus, yeah? Also quite common diagnosis, yeah? We meet also such patients, yeah? Here also joints and muscles involved, yeah, but often some internal organs, yeah? And of course here dry eye also present. Yeah, I would say rheumatoid arthritis and lupus erythematosus usually come to us due to other problems. Dry eye is okay, but number one reason is iritis. Yeah, this is a group of people who have quite often iritis. Yeah. Next picture is again conditions which connected to lacrimal glands, but it's non-Sjogren. Yeah. I found pretty good pictures that you have can visualize very well what are these other conditions, yeah? So it's non-Sjogren, non-rheumatoid arthritis, non-lupus erythematosus is non-Sjogren, it's something else, yeah? What you have to pay attention, age-related dry eye, left side, yeah, left. Age-related dry eye, I think everybody knows about this, yeah, that we are getting older and we are getting drier. with skin, everything, yeah. So I would say be careful with patients who are 45 plus, yeah. There are some other conditions you don't have to know this, just to tell you everything is there, yeah, about this congenital alacrimia. I have never seen such kind of patient, but yeah, just a little bit age related, yeah, and it will be primary lacrimal gland deficiency, yeah. This gland and glands which are on the eyelid, yeah. Second group is secondary lacrimal gland deficiency, yeah, secondary. It's due to some other diseases. Look, here it's very interesting list, yeah, lacrimal gland infiltration, yeah, and now we will go to this slide. I think we don't have to speak too much about this primary lacrimal gland deficiencies, but I tell you, age-related mostly, yeah? By the way, if appearances were likened to less severe grades of Sjogren syndrome, by the way, yeah? I mean, it could be also staining, it could be decreased Schirmer test, and it could be conjunctival staining with rose bengal, yeah, as well. But not so much as with Sjogren. Yeah. If you ask me what to do with such kind of patients individually, remember this table. Yeah, grade 1, grade 2 can use contact lenses. Yeah, without any problem. But just I tell you, for such kind of people, I would perform all 3 tests immediately. Yeah, Sjogren, this Schirmer, rose bengal, and fluorescein. Yeah. So, and now let's go to the secondary lacrimal gland deficiencies. So a little bit one mistake here, but it's okay. You know what? A little bit about sarcoidosis and lymphoma and AIDS. You know, sarcoidosis is lung disease. I have one here slide to show you, maybe not the best, but just have idea, yeah? You know what? It's actually a primary disease of lungs, quite spread in all populations living around the Baltic Sea, Scandinavian countries, and our countries as well. So sarcoidosis definitely have to be spread in Lithuania and Estonia as well. And actually, it is also autoimmune disease. Yeah, just in lungs. Yeah, and such kind of people are going to pulmonologist. But it still could be inflammation of joints, you see, yeah, on the picture, inflammation of kidneys, some rash on the skin, but as a primary is lungs, and sometimes it could be ophthalmologist who discover disease, because sarcoidosis can lead to posterior uveitis. Person come to me with a little bit strange complaints about floaters. By the way, keep in mind, floaters, especially in one eye, young person below 50, yeah. And person describes that he started to see some floaters, but he's young. So it's hardly ever, it could be posterior vitreous detachment, but he still can see something floaters in one or both eyes, yeah. You know, first of all, we suspect that there is posterior uveitis, and we have to examine properly retina. And in such kind of people, we often find some choroidal granuloma. This is just small white spots on the retina. Little bit bigger, little bit smaller, but quite small, maybe 1/5 of optic disc. Yeah, I mean, diameter of the spot, 1/5 of optic disc, yeah, and it could be few, yeah, few in one eye, few in other eye, yeah, and of course, in such a situation, also some vitreous cells we can see, and little bit minimum some cells in anterior chamber, little bit, yeah. And sometimes I tell you, the diagnosis is estimated by ophthalmologist. Yeah, and of course we send such patients for further examination. Yeah, but of course such kind of people will have dry eyes. Yeah, with one of these. I mean, eventually everybody who has some changes in eyes due to sarcoidosis, he has also dry eye issues. Yeah, again, a question about contact lenses. Evaluate using this table, again, evaluate in which group. It could be not so bad actually with sarcoidosis, yeah.